All right, welcome back, guys. It's still Breakfast Daily right here on ChannelOne TV. And we'd like to remind you that it's still Breast Cancer Awareness Month. And now it's time for us to get into a conversation that you are all excited about. The doctor in the house with us today is Dr. Wisdom Effiong, who is a medical officer at the Bank Hospital. And he's going to be taking us through things that we need to know about breast cancer, okay? So you can ask all the questions you want to ask. The phone lines will be open, especially, in fact, the WhatsApp lines will be open. So ask all the questions you would want to ask concerning everything you've heard about breast cancer. All right, Dr. Effiong, how are you?
Very well, by
You
grace.
are welcome.
Thank you. How are you too?
I'm fine, thank you.
I can see you're already glooming in pink.
In pink, right? Yes, yes, yes. I'm doing what I have to do. And that is, supporting in the awareness of breast cancer.
Breast cancer, yeah.
But breast cancer, let us get straight into it. What do we need to know about breast cancer?
Thank you very much for having me in the morning show. I would like to start with a brief definition of what breast cancer is actually. Breast is an organ that every man and woman has, right? Most of the time we tend to forget the men, right? But breast cancer also, affects men as well as the women. It's just that we have a significant number when it comes to statistics, affecting the women. More. So men don't tend to think that, oh, they are at risk of breast cancer and all that.
But what are the numbers in Ghana? Are there numbers or statistics that show that the men here in Ghana are also experiencing breast cancer?
So with regards to the men, we have a global statistics,
okay.
Because it's just a very handful, and about the 0.5 to 1% of men tend to be diagnosed with breast cancer. So
but
it's
the
more
women
of a global.
More.
Yeah, the women are actually more than that. I think that as at way back in 2022, about 6 million people the new cases were diagnosed globally, according to WHO, and out of that, about 600 of them die from breast cancer. So it's a burden. It's not just a national burden. It's a global burden that we should all take note of. I think that breast cancer is actually doing quite well in terms of awareness as compared to prostate cancer. Last month was prostate cancer awareness month.
And we didn't even hear
and exactly, you see, but this is the second day of October, and women are already talking about breast cancer, and I think that that's the way to go, really. And so the breast, I was talking to someone just yesterday, and I mentioned that whilst in medical school, we tend to refer to the breast as the only organ with the term glorified, the glorified mammary gland. And if you look at the anatomy of the breast, I don't know if you have an image to show our viewers. Like we can see on our screen, you'd notice that there's a nipple, with what you see up there. There's a nipple, and that, if we would get the image before that.
Yeah, can we get an image before that?
So there is an, yes, I like this image. There's a nipple, right, where if you are breastfeeding, that is where, the breast milk will come out from, right? And you notice that there are ducts, like there are tubes that connect the nipple to these round things that, is labeled lobules, and that's where the milk is actually stored, and when you need to breastfeed, is removed from that place through the ducts, and then it's coming out through, and then there's also some sort of tissue. Like,
you can actually stand up if you want to.
I can. Yeah. Oh, great. I think I like this. Yeah. So you notice that. So this is the nipple, like what I was saying, and then these are the ducts. And this is very important because when you look at breast cancer, you notice that the cancer can happen at any point in this anatomy that I'm describing, right? So the nipple is right here, and these are ducts that connect the nipple to these lobules. That's where the breast milk is stored if you are breastfeeding. And these are subcutaneous tissue, like breast mass. This just, tends to give the body, the breast, more tissue. And this is the chest wall, so you can see the ribs right here, and all that. So you can have the cancer. Let me just talk about cancer briefly. Now, cancer is an overgrowth of cell. So usually as we grow, the cell also grows proportionate to your development. But there could be a point in time where there'll be an overgrowth of cells, uncontrolled growth of cells. Now that's what we refer to as cancer.
But can we define cancer, or can we put in the category of autoimmune? because obviously autoimmune diseases are like, you know, when your body is fighting each other. But for my cells growing out of nowhere, is it not autoimmune?
I don't think that is classified as autoimmune. Yes, because autoimmune, like you said, a portion or a part of your immune system is fighting your body because it sees it as harmful, you know, to the body. But in this case, it's not fighting; it's just growing. You know, because usually there's always a cell regulator.
It's just growing, but it's causing problems.
Yeah, there's always a regulator in check, you know, that tells the cell, don't grow more than this, right? So the moment you have an issue with that police, that regulator, then it starts happening, right? And that will lead us to the risk factors. You know, there are some people that have genetic predisposition, so they have a family member, their immediate parent or sister who have been diagnosed with breast cancer. They do a genetic testing, they realize that there's a particular gene, it's called the BRCA gene, 1 and 2, you know, and then that gene is what, you know, causes that, you know, proliferation or growth, uncontrolled growth, you know. So that's why we tend to say get screened, you know, because not all, you don't want to wait till you get a lump, really, because I think that the education is moving from identifying a lump to just getting screened every year, know? Because we've spoken about it so much that we shouldn't wait till we identify a lump, right? So we always tell the ladies that at least 5 days after your menses, do a self-breast exam. Right, a self-breast exam. I don't know if it's something everybody knows how to do already, but self-breast exam. Reason being that there's something we call the breast memory, the breast memory. So you want your fingers to have memory of what your normal breast feels like. So the moment you identify something out of the normal, you know, there's a cause for alarm. You need to visit your health facility.
So I want to ask, looking at the pictures, are the tumors always in the lobules?
No, they're not always in the lobules. So, like you mentioned, so the lobule is one part where it could grow, lobular carcinoma, right? There's also the ducts. It could also grow
in the
within the duct. Yeah. So you know, and then as it grows, the name changes, you know. So you hear something like in situ, which means that it's still within the lobe, but it's not gone out of the lobe because it's in situ, right? And as it advances, it goes out. Then we now talk about spread. You know, we could have local spread to the remaining part of the breast, and then that's what causes some of the symptoms that we see, as you know, some dimpling. So you notice that when you look at the breast. I think you're good.
Yes. that's
a good one.
Yeah, for the orange, the orange skin.
Yeah, the orange skin. So that's just one, you know, of many of it. So
okay, so now we are talking about
symptoms.
Symptoms. Yeah.
So for the symptoms, when you look into the mirror, you want to, of course, without your clothes on, you want to gradually raise your hands, you know, whilst in the mirror.
So like that? Gradually
raising it up, whilst focusing at the breast.
Okay.
Right. So if there's any changes, if there's any dimpling
while you're doing that,
you would see that, because that accentuates dimpling.
Wait.
You could just look at it.
This is my first time hearing it like that. So you don't see the pod orange just by looking at it?
The pod orange you would see, but dimpling, you may not see if it's not very advanced. But pod orange, you see, like it's an orange pin, the back of an orange. You see that, right? But when it comes to dimpling, there are some maneuvers that we try to do to accentuate it. And one of them is just raising your hands up just like that. And then you notice even with the nipple changes. You could have nipple retraction, so your nipple goes inside.
It starts going inside.
Exactly, or nipple eversion, either it moves from the left to the right or right to the left. That's why you have to know your normal. You know,
your nipple can move from your right to your left or your left to your right.
Yes, because there's something going on within that is causing changes in the nipple, right? And then another maneuver we tend to do is when you sit down, you put your hands on your waist like this, and then you lean forward, tend to shrug your shoulders. So you're trying to, you know, squeeze the muscles of your chest wall, and that would also show us if there's any breast changes as well. So these are maneuvers, you know, we could do, you know, especially like I said, self-breast exam 5 days after, at least 5 after your menses, you know, during your menses, there's a surge of hormones. So the self-breast exam
after the menses, it's just the touching, or we can do all that. You know,
you can just look into the mirror and then do the self-exam. Now, when you come to the facility, then we can now do the various maneuvers.
It seems like every year we learn something new.
Yeah, I mean, it's amazing.
I never knew about, you know,
raising
the
up of hand
or, you know, doing that. I only know about the breast exam. And now let's talk about, you know, the exam. We have the hand one, obviously, and you've just taught us some ones that we need to look out for. But we also have the mammogram and the ultrasound.
Yeah.
So I didn't know much about the mammogram. It was just last year that I discovered it, and they said it's from a certain age to a certain age. But I experienced both. I came to your place. I experienced both. I was like, I want two of them. I was like, I want two of them. I went to the bank customer. They said, oh, what do you want? I said, I want two of them. I just want to experience two of them. Take me through it. But it's quite interesting. It's quite interesting because the mammogram is for a certain age to a certain age, and that has to do with your breast tissues. You know? Explain to us. Explain more about it.
So you look at when we talk about risk factors, we mentioned age as one of them. We didn't actually go through all of them, but we mentioned age as one of them. And the age we're looking out for here is those 40 years and above. Right, and those 40 years and below, right? So being 40 years and above would advise that you undertake a mammogram, and then 40 years and below an ultrasound, provided you don't have risk factors, i.e. a family history of breast cancer, or BRCA1, BRCA2 gene, right? Now, the reason this is so is because the younger you are, the more dense the breast tissue is. Like I said, during your menses, you know, there are a lot of glands, you know, so you can actually feel certain things that feels like a lump. But these are the things that you are feeling, perhaps, you know, the breast tissue, right? And these are very huge, you know, up there. So if you do a mammogram for a younger adult, you might not be able to delineate between, you know, an actual breast mass and your normal breast tissue, because mammogram is like an X-ray, really. Come to look at it, but an ultrasound should be able to pick that up, right? But as you grow beyond 40 years, the breast tissue, the density reduces. So with that mammogram, you're able to pick up, you know, a breast lesion with speculations and all that. So yeah, so I think that is the reason why we do that. That being said, there are certain people who are younger than 40 that we still need to do a mammogram. Like I said, if you have...
And people that are old, that are actually 40 and above, that still need to do like an ultra.
No, but if you're 40 and above, we advise you just go straight to do an a mammogram, I beg your pardon, right? Yeah, so that's the imaging part, and we'll do this after we have examined you clinically, right? And it's important to note that...
And you guys even do MRI for breast?
Yes, it's possible to do an MRI.
I saw everything, I was like,
yeah, it's possible.
So like you even do MRI for the breast?
It's possible.
Why?
We do that.
What leads to that stage of doing an MRI to the breast? Because I only thought the MRI was for different things. But I did MRI for my legs and my shoulder because I had a dislocation and all that. But when they said they do for the breast, I was like, what?
Yeah.
Could it be that bad?
Yeah, so you know that there are certain people, like we are all different, you know, and that, let me just talk briefly about the theme for this year. Every story is unique.
Right.
You know, every journey is different, you know, and you notice that every patient is different. You know, there are certain people that you might not be able to tell that, okay, are we looking at breast cancer here or not?
Or something.
Let me just do an MRI just to further confirm. You know, that is for, especially for those who don't have a lump. I mentioned those who do not have a lump. You want to do an MRI because MRI is able to pick very, very tiny tissues of the body,
so
right? But for those who have a lump and you can palpate, you can feel that lump, we want to do a breast biopsy. So we'll stick in a needle right straight to that lump, and then we'll pick in that tissue, and they want to test under the microscope to find out if it has a name. Should be able to be dealt with. But if there's no name attached to it, it'll be difficult to deal with it, right? So we want to identify the name and the origin, the name and the surname. Like I mentioned, it could be lobular carcinoma, there could be ductal carcinoma. So does
that make it a cancer?
carcinoma, yes, it's a cancer. Once it's carcinoma, but not all breast lumps are cancerous.
Yeah, I learned that.
Yeah, but if there's a term carcinoma attached to it as a suffix, then that is a cancer.
Yeah.
Right.
This actually makes me very emotional because my best friend's mom actually died of breast cancer.
Oh, wow.
Yeah. But it's nice to see how things have evolved.
Yeah.
You know, how awareness is being made of it and how we are being advised to go to the hospital and, you know, check and all that. But now talking about the test, how many times should we, I don't want to call it a test, like talking about examining, how many times are we supposed to do that?
It's a good thing we have a self-exam. We don't have to come to the hospital for that. With that, we advise to do it every month. Every month because you'd have a memory of your breast. So if something changes, you're about to tell. You can't tell, right? But for that if you notice something different, then you report to the hospital. But we'd advise that, you know, for young adults, at least 1 to 3 times in a year, in 1 to 3 years, get a clinical exam for the hospital.
1 to 3 years.
And
what about
so you can do it every
40?
year, actually. That's why we tend to say October, you know, is earmarked for breast cancer awareness. So you can tell yourself every October you're going, provided you don't find a lump in September or in July. But if you find a lump in August,
you have to
I guess it's the month of my birth, so I don't think you'll find a lump in your breast in August. That's just by the way. Right, if you find a lump prior to, you know, the month you have scheduled, please go visit the health practitioner and get it checked. Yeah.
These things get really tough for women,
I
know? And sometimes there are no causes to really what happens, especially if you do not have it in your family. If you don't have it in the cell, sometimes it just comes up. Why?
Yeah. So it could be sporadic. That's why we say that the fact that you don't have a family history of breast cancer does not mean you cannot have breast cancer. You know, there's actually WHO conducted a worldwide, you know, survey about lifetime expectancy when it comes to the number of people in their lifetime that will be diagnosed with breast cancer, and they said 1 in 12, and I find that alarming. You know, and actually there are people who have survived breast cancer, and that's the reason why, you know, of course, if it's something that cannot be prevented, we shouldn't be here in the first place. People have survived breast cancer, and I just don't want that stigma to be attached to it, because the moment people think that I have a lump, they don't want anybody to know about it.
They don't even want to come to the hospital.
Exactly. And even those without a lump, you know, who tend to see certain discharge, you know, the nipple I mentioned, if you're breastfeeding, you'd get discharges like milk. But if you have bloody discharge, different colors of discharge, that is not normal. Without a lump, you know, you want to present to the health facility, you know, to get checked, because it's very important.
And we have some questions here. Good morning, Doc. Does sucking breast help reduce breast cancer? This is Kwame from Pokwasi, really Kwame.
Interesting. I think the men tend to ask questions like this every year. I would not directly say sucking breast helps reduce breast cancer. No, that is not statistically proven. However, married people who tend to engage in intercourse with their partners and with the breast, they tend to have memory of the breast. They tend to know how their partner's breast feels like. So now when there is something different, their partner would be able to identify, because if you have refused to do a monthly check, your partner will
At least the partner can do that.
He
does
check
every day
for you, a daily check, or sometimes 3 times a day, depending on the home you're coming from, you know. Yeah, so your partner will do that, you know, and then, you know, there's something different I am feeling. That's why we educate the men as well. There's something different I'm noticing. It wasn't here before. So that will prompt your going to the hospital, rather than saying sucking of the breast, you know, reduces. Now, let me just state that breastfeeding helps reduce the risk of breast cancer. Now, that is different from sucking of the breast, like Kwame is coming from, right? Breastfeeding, a woman...
Not feeding an adult man.
Not an adult man,
Not nipple sucking.
Right, so breastfeeding is actually seen to be one of the risk reduction for breast cancer, and so as early menarche, you know, those who tend to have their menses early on in life, less than 15, 12 and all that, they have a higher risk of being exposed, because it means that you've been exposed to so much hormones.
Yeah.
You know,
At an early age.
Some people start their mens as
even 10.
9.
Yeah.
9, yeah. You mean, so there's a risk, you know, or late menopause. You know, some people.
Late menopause is a problem too.
It's a problem.
So now we should be praying for the menopause to come
early. It means
early.
you're exposed to these hormones too long enough.
Oh gosh.
So much so that, you know, so late menopause, those above 50 still having their menses is actually a risk, you know, factor, you know, for having.
Can you stop can you make the menopause come early? Can you make the menopause come early?
You know.
Oh my.
You know, and another thing to also help prevent is actually getting pregnant. You know, pregnancy is also risk reduction. You know, those who are pregnant, you know, tend are not exposed to these, you know, hormones, and so that helps. So pregnancy, breastfeeding. So that period you are safe, you know. Yeah, so yeah.
Now I'm thinking, should we have a lot of babies? Anyway, we have another one here. Good morning, Chris and Doctor. There's fondling the breast and sucking vigorously cause breast cancer. So this one, he's not asking if it prevents it. He said, does sucking it vigorously cause breast cancer? So I guess it's people that are very, you know, I know sexually some people can be very
vigorous. Now, vigorous fondling of the breast would not cause breast cancer. Okay. Like I said, it would help you identify if there's a lump or not. And there are other breast conditions, you know, that people just don't know of. There's what we call mastitis. You know, painful breast.
It's so painful.
You know, it could also be, you know, a young adult with a lump. It could be a fibroadenoma.
Fibroadenoma.
It's benign.
I learned that.
You know?
I learned that last year.
Yeah.
Fibroadenoma.
Yeah, it's benign. You know, some people would have breast cysts. You know, you could have a cyst, you know, fluid filled, you know, when you palpate on it. And
they also have their symptoms on the breast, right?
Yes, it's still on the breast. And you have pain. Some people would have pain, swelling, redness, you know, and all that. So not necessarily breast cancer. And that is why you need to get checked. And I always say that the eye sees what the mind knows. So you could be seeing it, but you will not be able to interpret it. But a health professional who knows will be able to interpret and tell you that, oh, I think you are safe. Or I think that, no, let's further investigate to find out what is this. Let's get a name for it and all that. So yeah, so it doesn't necessarily cause breast cancer.
Wow.
From what he's saying.
Wow.
Yeah.
But what are some things that we can do that can also protect us? Yeah, you have already stated the fact that it can just appear sporadically. Yeah. But what are some things that we can also do to also protect ourselves?
So there are also some lifestyle modifications that have been a culprit for so many other medical conditions. You know, smoking, drinking of alcohol, these are also very huge risk factors.
So when you say drinking of alcohol, let's make it clear. Is it one glass of wine?
So usually you don't want to do more than 14 units of alcohol in a week.
Okay, in a week.
In a week, okay. 14 units in a week. In calculating that, maybe you see me at the consulting room, they will do you know, a one-on-one calculation for that, because usually we use the percentage, you know, and the volume that you consume. And different alcohol with different percentages, 12.5, 50%, 30%, and then the volume. Are you taking 20 mils? Are you taking 50 mils? We do that over a constant, right? So like I said, I don't want to teach people that and then they go to the drinking parlor and then they're like, no, let me calculate and do my drinking. So alcohol, you know, 14 units and above in a week is actually deleterious, gives a deleterious effect to the breast. Smoking as well, you know, can be, you know, seen in not just breast cancer, so many other cancers, bladder cancer, prostate cancer. You know, smoking increases your risk. You know, living a sedentary life, you know, from your car to your house, from your house, your bed, back to work,
to your
no
office,
exercise,
sitting on the table for long,
you know, so that also increases your risk. Obesity, you know, is part of that. Lack of exercise. Usually we'd advise that you exercise about 150 minutes in a week. Right, so that which is about translate to 30 minutes in a day, right? So that should also help reduce. You want to do what you can do about the things you can do things about. You know, for some of them, having a family history, you really can't do much about that, you know.
You just need to go examine always.
Yes, you just can't do nothing about it. And I'd also want to state that there are people who have been able to pick up these genes, and then therapy have been given to them, you know, and what we call prophylactic mastectomy, you know, removal of the breast, when we have identified that you are at a higher risk, 200% risk.
So they just remove it before it happens.
Take it out, before that. And then breast reconstruction is also done for people who want to, you know,
have breasts.
Who have breasts, exactly. So I think that people should not be afraid. You'd live longer if we pick this disease earlier.
Yeah.
Otherwise, you notice.
And it doesn't always translate to taking your breast off completely.
No,
it
doesn't. It doesn't.
Yeah.
We haven't gone to treatment yet.
Yes.
I just mentioned that. You know, I haven't gone to treatment yet. You know, there are so many treatments. Like I said, every story is unique. Every person is different, depending on your particular person and what exactly we find and the stage in which we find it.
Yeah.
Then we'll administer. We'll discuss treatment options.
Right. Anyway, Doc, it was really nice talking to you, but you have one last message here. Doc, how are you keeping a straight face talking about this? It's really cool. I'm smiling ear to ear, but I'm learning. Anyway, Doc, before we let you go, how can people reach out to you and, you know, even your institution? How can people reach out?
Yeah, so at the Bank Hospital, if you walk into the Bank Hospital at Cantonment or any other facility that you're close to, but the Bank Hospital, when you walk in, just tell them you just need to get screened. Actually, there are discount rates. Most facilities do that, you know, just to help.
Especially this month.
Yeah, exactly. And if you let this month go by, that would be difficult. So you could just walk in and mention that you want to get screened. If you haven't, or you suspect a lump, they'll take you through the process. You know, if you need to do an ultrasound, we'll do that for you. If you need to do a mammogram, we'll do that for you. If you need to do a biopsy, where you want to take a bit of sample, maybe from the lump that you are having, to identify is it cancerous or not, that could also be done for you.
All right. Doc, thank you so much. I mean, it's really nice having you on the show, and we have learned a lot. And ladies and gentlemen, we've been speaking to Dr. Wisdom Effiong, who's a medical officer at the Bank Hospital, and he is the doctor in the house today. And he's advised so much, and all we need to do this month, especially the ladies, is please get screening. You know, go out there and start, you know, visit the facility and just screen. It's very, very, very important. Very, very important. If you can't do it at home, go to your doctor. If you can't go to your doctor, walk into any facility, especially this month being October. I'm sure there are discounts. Some are doing it for free. Just go and screen. It's very, very important. Anyway, thank you so much, Doc. And it's been a nice one. My name is Chris Carter, and this has been the Doctor in the House. See you next week.